Hi, I'm Dr. Roadhouse, and want to introduce you to my patient, Christy. And Christy just started our thyroid program, so we're going to be doing some videos throughout her care so we can chart her progress. And Christy's had a thyroid problem for some time now, and she's going to kind of tell you about that, about the symptoms and stuff. The cool thing about this is that this was your birthday present, from your husband, which is pretty cool. And if you want to just talk about, like where you've been, and remember we were talking about the last couple of weeks before you came in, how all of a sudden a lot of things crashed for you and stuff. But why don't you just kind of talk and give, some information on where you were, all the stuff, and just kind of your story, okay?
I started out after college having symptoms, not recognizing a lot of them up front, and my mother brought it to my attention, and she said maybe there's a thyroid issue or something, and she was actually seeing a doctor here in Tulsa for that. So I think I went to his office and also went to my primary doctor and expressed my symptoms, and I'm not sure quite at what point was on medication for that, but was put on medication, and then throughout the years, of course, that's been adjusted increasingly and greatly. I think I started off, I want to say like 40 or so, and when I'm currently at 260 milligrams a day, which is a huge problem. As far as that's not normal for a normal person to have those issues. So clearly,
and let me just say, that's a really high dose. But at the same time, as they were upping it, wasn't helping you at all.
No.
And that's why they were upping it, right?
Yeah, I mean, temporary relief, maybe a couple weeks. Of course, my mom would want to know, hey, babe, how's it going? Oh, it's going okay, and then I would just push aside those, those symptoms, and the fatigue, the constipation, the cold hands, the hair loss. I mean, I could just go on and on. The depression, the anxiety. I actually smoked for several years, probably due to a lot of my anxiety, which I was smoking just to smoke because there was, anxiety problems, and I was able to overcome that to actually become part of this program. So, which I'm very happy about. But anyway, looking forward to feeling better, because over the right before I started this program, it was phenomenal. The depression, the feelings of helplessness. I mean, just utter bottom. I don't even know how to explain it. I'm sure that you see a lot of patients that way, where I felt like I've been to every doctor. I've actually been to, another doctor and my primary care physician, and they just kind of look at me with a blank look, and it's not their fault. They just don't have the training that you have, and the procedures that you have. So I'm really excited about starting this program and feeling better. I have noticed that just in the few weeks my headaches are better. So that's great news.
Yeah, because we've just started and you're already having some improvement.
Yeah. So I'm really excited about that, especially on days like today where there has been a lot of weather changes. And I would always blame it on the weather or something, but I'm sure there was more. So I'm starting to see some results from that. So I don't think I've actually had a headache here in the last couple of weeks. So that's.
And sometimes, a lot of the patients, like we had another new thyroid patient that had this twitch in her eye, and it went away for a couple of days, another late. So sometimes when you've experienced what you experienced, been to all the doctors and stuff, and no one's helping you, and then you come somewhere and you just get that. I mean, to most people, they're going to go, a big deal, sore headaches a little bit better. But you don't understand, how you have all these different symptoms, and sometimes just in the beginning of the treatment, just to see light at the end of the tunnel, like, hey, my headaches are better. And, also going back, you remember when you signed up for the consultation examination, we sent you that DVD with all the information, stuff like that. Part of the thing is, when we're explaining that, is like, you don't wake up one day and have all these symptoms.
Right.
And so, like you were talking about in college, you kind of had some symptoms, but then as time goes on, then those symptoms start becoming worse, and they become more frequent, and then they stay there, and then you start having more and more, and you got to the point where, it's really affected your health.
yeah, I mean, and I knew, I mean, deep down I knew, I've been progressing this, especially the last 2 years. It's been like, okay, I go through, 3 months of seeing the doctor, or maybe adjusting my medication, and it's like, yay, and then it's like, oh, symptoms are still there.
And a lot of times when they do adjust the medicine, give you a higher dose, you do feel better for a little bit, right?
Yeah,
Because it is a powerful hormone, and so you start to think, oh, and then
yeah, and then
yeah.
and then it's the same, back to the same things, and so yes, I did feel those highs and lows.
Okay. Well, what we're going to do is we're going to follow. Christy's just got done. I think it's been 2 weeks that
Yep.
we've been treating her neurologically, and then she's done all of her labs. And so now we're just going to wait. It takes 3 to 4 weeks to get all the labs back in, and we're going to start doing some new treatments on you next week. And then when we get the lab results in, we'll start adding some more. But we'll check back with you in about 6 weeks and see how you're doing. Okay, welcome aboard, and I'm glad you got all your labs done, and we're looking forward to helping you.
I'm really, really excited, and really, really blessed that Dr. Roadhouse has taken me on as a patient, and I know he'll help others too, so looking forward to that.
Thank you very much. All right, we're going to get started and get you all fixed up.